strikes fear in many people's hearts, but in actuality, it's a fairly common infection we see in urgent care. And in central care in Florida, we see about 1 case a week of scarlet fever. What I tell patients is that scarlet fever is simply strep throat that's accompanied by a rash. Now, the reason scarlet fever gets such a bad rap and there's so much concern about it is that there was a different strain of the strep bacteria that causes scarlet fever back at the turn of the century, where we're seeing epidemics in crowded living conditions at the turn of the century, of course, with poor sanitation, no milk pasteurization. There's a lot of reasons that this became a problem and had a fairly high mortality rate. But there are a couple of things. Number one, it's a different bacteria, different bacterial strain over time. And number two is we have antibiotics. Modern medicine's great. So that has really reduced this being a serious infection. So getting put on an antibiotic will clear this up right away. But there's a good point to remember that if you have a combination of a fever and rash, if your child has that combination of a fever with a rash, that's a good indicator to go to the doctor, come to Central Care, have it evaluated, because there's a lot of different things that can cause that combination, a lot of worrisome things, one of which is measles. Another one would be chicken pox. I could list roseola, Fifth disease. A lot of different things can cause that fever and a rash. Some of them are concerning, some aren't. Takes a skilled physician to figure that out.